name is Michelle Cooper. I have been practicing OBGYN for the past 25 years in Delaware. I have 2 kids. They're twins. They're 22, and I married my high school sweetheart. So I've been here with this practice almost 20 years, and I started getting into integrative medicine around, I'd say, 2013. I had some health problems myself, which got me started thinking about it when I was younger. I had a thyroid problem and autoimmune, and never really felt good afterwards in the treatment that I got. But I just kind of put it to the side, thought it was normal. And when I started practicing, I noticed after a few years that I'd say most people got better with traditional treatments, but there are always a subgroup of people who needed more. And I was really trying to focus in on that group since I was doing really well with the other group. And I started getting into hormones, and the colleagues who were teaching me a lot about hormones got me into integrative medicine. And when I started doing that, a lot of the puzzle came together for me. And integrative medicine is basically a way to look at the body as a whole, as opposed to, okay, you're made of a heart, a lung, a kidney, a brain. It's more of your body is a bunch of cells, and how we're going to get these cells to work together optimally. And going through that fellowship, which I finished in around 2014, have really helped me bridge the gap and look at the body in a different way. So I was my first patient, basically, after the fellowship. I fixed myself and felt better. Then the rest of my family, they had some issues, and then I started the program. And I've had really good success. I think that people who really want to look for root cause and look at the body as a whole, and people who aren't having the best of luck with multiple specialists and are frustrated, it's a good place to be. So when I started really going down the path of the patients that I said that were harder to treat and not getting what they need out of traditional medicine, and I wanted to fix myself, I got introduced to my fellowship, the American Academy of Anti-Aging Medicine, and I started the fellowship, and it took me 3 years to finish. It was fantastic, and it really pulled everything together for me. It was hard to do when I was raising my kids and delivering babies in traditional OBGYN, but I really think that it made me better at my job as an OBGYN because I have a much broader view of the human body, and I understand it from multiple disciplines, and it really helped me build this program and do functional medicine in a way that is based on good data and credentials. Basically what we do in the program is look at the body from the outside, basically a different way of looking at the body as a whole. So a lot of people will be seeing various doctors of different specialties with different complaints like GI or neurological or hormones, and basically getting medicines for each of those things. So what we try to do is try to find the root cause of the problems. A lot of times there's one root cause that could affect the entire body, and by breaking those things down, instead of just the symptoms, it could really, really help bridge it all together and help the symptoms. And then once the symptoms are helped, it really actually gives the person wellness, longevity. We all want to live as long as we can. We don't want to get dementia or heart disease. And by fixing inflammation and various things that cause all of those problems, that could help you live longer and healthier. Pretty much anybody could be my ideal customer. Everybody needs functional medicine. Everybody needs wellness. Everybody should be healthy. Nobody should have inflammation. But typically, there's a few different areas that I see. One, I see a lot of people who have basically not gotten what they wanted out of traditional medicine. So they've seen multiple, let's say someone who has fatigue, hot flashes, and body pain. I see a lot of things like that. And they have fibromyalgia or some type of body inflammation, they're in pain. So they're seeing a doctor for all their pain. They have headaches and they're seeing a neurologist for that. They're seeing a gynecologist for their hot flashes, and their regular doctor because they're tired, and endocrine possibly because they're so tired. And how do we pull it all together? So there's a lot of people like that. Also GI, a lot of those people have GI problems because unhealthy gut is a big cause for inflammation. So that's one big part. People who have been seeing a lot of other providers and not getting the results that they want. And then there are others who just want a partner in menopause. I do a lot of hormonal therapies, or just a partner in wellness overall. People who's may have family history of heart disease or dementia or autoimmune, and they want to prevent that for themselves, or diabetes. I see a lot of that, people who want to use the natural approach, try to come off medicines and have a more natural approach to their well cares. I like to make all the visits very interactive, but basically the patient is really going to need to put in a lot of work. It's not just here, take all these supplements and take these hormones and everything's going to be fine. It might be with some people, but I give a few books to read. We talk about stress management. It can be very, very hard to manage your stress. Very difficult, but that's important. And toxic exposures, potential dietary changes. If people come in with GI issues and they're eating foods that are causing the GI issues and they don't stop eating those foods, those GI issues are going to continue, and it is very hard to change the diet. I mean, some people have a very hard time. That's understandable. So it's a lot of work, a lot of trial and error. I need people to say, okay, this didn't work, but I tried this and that worked great. Oh, okay, you told me to do this, I did it, and then I read about this, what do you think about this? And then we tried it. People taking the initiative with their health, and that's when it works best. Different conditions that I see and treat: menopause and perimenopause, pretty much all hormonal imbalances, polycystic ovarian syndrome, PMS, premenstrual syndrome, and sometimes the more severe form, which is PMDD, andropause, also a lot of GI, bloating, gassiness, reflux, fibromyalgia, body pain, autoimmune, most autoimmune, mood disorders, depression, anxiety, which often go along with hormonal things. Fatigue, chronic fatigue is a big one. Toxic exposures, low sex drive. It's really important, if I think about the word symptoms, to treat your body before symptoms ever occur. A lot of people will say, oh yes, this person was so healthy, and then all of a sudden they got cancer, or all of a sudden they had a heart attack, and they were healthy up until that day. But really, all of those changes were going on for 10 to 20 years in their body. They just didn't have the symptoms. So health, and I say this all the time, that health is not the absence of symptoms or the absence of disease. Health and wellness is more of an active thing. That's what we try to do in this program. You have to build it and work at it. And when I hear the word symptoms, that's really just a later stage in whatever's going on, because things start happening way before the symptoms. A lot of times hormonal imbalances are due to other things going on in the body. When women are experiencing menopause or perimenopausal problems, it could be very disconcerting and feel terrible and really take over your life. Hormone replacement therapy, which we do a lot of in here, could definitely put a Band-Aid on those symptoms. But what I like to tell people, and what's different about just giving hormones versus this program, and they're both fine, but the difference would be something, this type of analogy that I use a lot. I like to think of hormones as icing on a cupcake. If the cupcake's great and you put icing on, everything's perfect. If the cupcake's not so good, the icing helps, but there's only so much it can do. So this would give you icing and also look at the cupcake too. And that's how the hormones work the best, feel the best. Some people, you fix the cupcake and then they don't even need the hormones. All the symptoms go away. So that's the difference between just giving hormones and what we would do in the program. I believe in really the combination of traditional medicine and integrative medicine. You need traditional medicine for your overall health. I'm an OBGYN. I do traditional OBGYN things. People need hysterectomies, people need medication, people need a lot of different things. So I believe in all of it. And a lot of times it just could be complemented by functional medicine. So when people, let's say, have a lot of GI problems and they're seeing GI, I never change the plan of what their specialist is doing, but we might work alongside them with dietary changes and digestive enzymes or certain supplements that could help them. And it works much better when we're all working together. I think it's important to consider this approach because I think most people don't realize how much power they have in their own health and well-being and longevity. There's a lot of things that people can do that they don't realize to allow them to live longer and live better. Everybody, or I shouldn't say everyone, a lot of people come in and say, oh, yes, my father has dementia, it's just, the way it is in my family, or everyone has heart disease, or everyone has breast cancer. And really, we could control 70% of our genetics with lifestyle. So this approach is very personalized. Every person is different, and it allows a much deeper approach to their health by really looking at all the things that could affect their DNA, their life, and their longevity. It's data-based, and everybody should live as long as they can and feel as good as they can. That's the whole point of the program, though. That's the entire point of the program. And people, I don't think, realize that that's even possible to do. A lot of integrative medicine is not recognized by insurance companies. It's just not big in the healthcare system. So one day, hopefully, it will all be covered. But as of right now, not all of it is covered. The visits are very long, and some of the diagnoses we use are just not recognized for any of the insurance company to cover. So there's an out-of-pocket expense. Supplements, and you know how it is in the health food store, none of those are covered under your insurance. And labs, some are covered and some are not. So it's definitely an investment in your health. So the first visit, we always block out an entire hour. There's a lot of talking and education. My very first question that I ask everybody at the first second of the visit is, what are your goals for the program? So they start by telling me their goals, and then I basically ask them a lot of questions about their life, what they do, are they happy in their marriage or their relationships, are their children healthy, what kind of stressors they have. We talk about toxic exposures, have they had tick bites, have they had water damage in their house, that can mean mold. Lots of different toxic exposures that could exist. We go through that, and then we go through your typical medical history as well, all medications, family history. So we spend a lot of time doing that. Once that's all done, we go through their diet, every little thing that goes into their mouth for the past couple days. And often I'll Google the brands of what they have, so I really see what they're having. Then we sum up their most important goals, and rank them from 1 to, let's say, 5. And I keep that list because we go through it every single visit, what their goals were and where we are with that. Then, once that's all done, I go through basically how I like to look at things. We talk about how the different hormones work together. We talk about the gut microbiome. And then we talk about what kind of testing I would recommend to look into the root cause of their problems and how to achieve wellness. And we agree on testing, go through everything, and that's basically the first visit. Often we'll give some supplements or even medication or something. I don't do a lot of treatment on the first visit. We make a lot of dietary changes and lifestyle changes at that visit. And maybe if they're really, let's say, having trouble sleeping, I might aid them with a sleep supplement or something. But once I have all the testing back, which is the next visit, we get more specific in the therapy.